Hi, everyone. We're going to go ahead and get started. My name is Gwen Heener. I'm ECCN's research manager, and welcome to our webcast today about ensuring research ethics in field research in crisis and conflict environments. Before we get started, I'm just going to read a quote from a paper called Ethics Abroad, Fieldwork in Fragile and Violent Context by Cronin-Furman and Milli Lake. I think as we read this quote, we should really be thinking about what is the central message of today's webcast. They write, "The diversity of political spaces, availability of cheap labor, ease of access to powerful figures, and safety net of a foreign passport attract researchers to the developing world. However, environments of extreme state weakness and ongoing conflict permit research behavior that would be frowned upon in the global north." Today, we're going to be talking about how we do rapid assessments to inform programming and education in crisis and conflict programs. Of course, it's really important to do research and assessments to better understand the locations in which we're working. One research project or one program design does not fit everywhere. So we need to understand what are the contextual differences in a location and the people we're trying to help in order to program better. Also, in crisis and conflict environments, things can change really quickly. Things can change within a week, a month, or even a day. So in order to have the best up-to-date information about what it is that we're trying to do, we need to do rapid assessments. However, in education, we're working with vulnerable people, young people, and therefore we need to be especially aware of the ethical dimensions of what it is that we do. ECCN has developed two rapid assessment toolkits. One is the Safer Learning Environment Assessment Toolkit. The other is the Rapid Education and Risk Analysis. Both of these are designed to help inform programming to be better. However, they're meant to be done rapidly also. While there are sections within each of the toolkits to help you do ethical research, we wanted to have this webcast in order to better understand what does that look like in the field? What are some of the challenges that we face when trying to do ethical research rapidly? What are some of the trade-offs when trying to do ethical research rapidly? And the big question, can you even do a good research project fully ethically and rapidly at the same time? So once again, I'm Gwen Heener. I'm the research manager for ECCN, and also I developed the SLE Toolkit and worked with a number of teams in piloting it and learned a lot from them about some of the ethical dimensions of doing this, and a few of those are with us today. We also have Apollo Kwake and Edwinio Bowman from EDC Liberia's M&E team. They piloted the SLE Toolkit and also did a RERA in Liberia for their activity. We have Kiengi Frank, founder and executive director of Advocacy for Child Relief Uganda, and Dio Sabwera, a CRUG's M&E specialist. They piloted the SLE Toolkit for a safe schools and child protection intervention they're implementing in Kirindongo refugee settlement in Uganda. We also have Miriam Benel-Sassi and Sarah Gates from FHI 360, who between the two of them worked on one SLE assessment in Senegal and 3 RERAs in Senegal, DRC, and northeastern Nigeria. We also have Jim Rogan, ECCN's conflict specialist and author of the RERA, and he's led RERA field teams in El Salvador, Bangladesh, and Dominican Republic. And finally, we have Ashley Henderson, USAID education specialist with their EICC team, who's been a huge support to ECCN developing both of these toolkits and also has been involved in implementing RERAs herself. A couple logistical points about this webcast. We're having a more Q&A format rather than presentations. So what that means is as we're talking, we do encourage the audience to drop some questions into the Q&A chat window, which you saw at the opening screen. We'll be looking at those as we go through, and I'll do my best to call on presenters as I see questions that are relevant. If we don't get to them, then we will have time at the end to address them, but please drop your questions in there. So I'm going to pass it on to Ashley, who's going to talk a little bit more about some protocols that can be used and also USAID's work with these tools. Ashley?
Thanks, Gwen, for that introduction and that very provocative quote. I think it really highlights why we're discussing this issue this morning. Good morning, everyone. As Gwen said, my name is Ashley Henderson, and I'm an education specialist in the Education and Crisis and Conflict team at USAID. It's worth noting, of course, that among my other duties, I have also participated in 3 rapid education and risk analyses in El Salvador, Nicaragua, and Bangladesh. So as Gwen noted, assessment and contextual analysis is a critical step in conflict-sensitive education. You have to understand the context in order to be sensitive to it. However, your assessment or analysis must also be conducted in a conflict-sensitive way. So this means prioritizing the safety and the protection of the people participating in your analysis. Our panelists today will talk about exactly how that is done in the various steps of planning, implementing, and finalizing their research. For now, I'd like to say a bit more about the two research methods that Gwen already mentioned and that our panelists employed. So that's the Rapid Education and Risk Analysis Toolkit and the Safe Learning Environment Assessment Toolkit. As Gwen noted, both products were developed by ECCN and are available on the ECCN website. They're also available on the USAID education website, education links. So look for them there. The Rapid Education and Risk Analysis, or RERA, allows USAID and implementing partners to obtain a snapshot of how education systems, learners, families, and their communities interact with a dynamic, multiple risk environment. So the RERA integrates key elements of conflict analysis, disaster risk analysis, resilience analysis. It is distinct from the SLE Toolkit in that it explores a broader context than the school environment, including, for example, community dynamics or broader political context in the country. The RERA utilizes portions of the SLE Toolkit, however, the qualitative portion and the scoring rubric. So if you use both those tools, you'll recognize some familiar text as its primary data collection tool in school communities to inform the broader context analysis. The SLE Toolkit, in contrast, on its own is limited to assessing only the specific program context to obtain a snapshot of the situation for the purposes of improving program design, implementation, and M&E. The SLE Toolkit is also intended for it to be completed by a more junior research team, and it's less expensive than the RERA, also can be completed more quickly. So these are important aspects to contrast when deciding on which tool will suit your research needs. I also want to note that the SLE Toolkit has guidance on both qualitative and quantitative data collection, and each researcher can decide which method is appropriate for their research questions. Both of these research tools focus on how risks like school-related gender-based violence, gang violence, or violent extremism impact the education of children and youth. These are sensitive topics with a sensitive population, which makes protection an incredibly important consideration. Both the SLE Toolkit and the RERA, as Gwen noted, offer extensive guidance on the ethical considerations of conducting this sort of research, but it's always hard when you get in the field. USAID's Office of Education also offers a policy brief on ethics in education research with guidance on engaging with institutional review boards, if you haven't seen it. That brings me to my final point before I hand it back over to Gwen and our panelists to discuss their experience. Most of our panelists today will discuss their experience engaging with IRBs, or institutional review boards. Just so we're all on the same page, what is an institutional review board and what role does it play in protecting research participants? So an institutional review board, or an IRB, is an administrative body established exclusively to protect the rights and welfare of human research subjects recruited to participate in research activities. The IRB will review before the study is conducted the protocols, plan, and approach for all research involving human participants with the objective of protecting the welfare, rights, and privacy of human subjects. The IRB has the authority to approve, disapprove, monitor, or require modifications in all research activities that fall within its jurisdiction as specified by both federal regulations or institutional policy. IRBs are important because they are independent from the investigation and exist solely to protect research participants. Any institution that conducts research, either public or private, may have an IRB. An IRB is the final authority on the question of ethics in research, so we don't have to be. However, it is essential that we are thinking about the protection of our subjects, taking that viewpoint of the IRB from the beginning of planning our analysis, to anticipate some of the IRB's input and also ensure that the risks to our subjects don't outweigh the benefits of conducting our research. With that, I'll turn it back over to Gwen and our panelists.
Thanks so much, Ashley. That was really helpful. So first, as Ashley said, we want to talk a little bit about the formal process of institutional review boards. And so first, I'm going to turn it over to our friends at EDC Liberia, who did undergo an institutional review board process in Liberia. So Apollo and Edwinio, take it away.
Yeah, thank you. So we will more specifically talk about the subplanning environments assessments that we conducted in October, November 2018. which we did as a baseline, but also a follow-on to the RERA that we had conducted earlier. And the focus of this was to give us a better understanding of the perceptions of risk, as well as the prevalence of different kinds of risks to students within the accelerated learning program centers where the activity operates within Liberia, and also be able to prioritize some entry points for interventions in those centers.
Yeah, and basically we were, for that, we were targeting children in those schools that we were implementing in 6 counties around Liberia. We did mapping of schools that we wanted to implement those in. We also had to be able to do the, mapping of who we wanted to talk to, looking at the topic, which was very sensitive. We have students within our program that are between the ages of 8 and 15 years old. And looking at the content of the research, we could not interview all those students. So going through the technical working group, we were able to decide that based on the sensitivity of the questions, which target group are we going to use as respondents. So basically, we were able to decide that work with the TWG, we are going to interview students between the ages of 12 up to 15 years that are receiving the intervention from the ALP program, or the Accelerated Learning Program.
Yeah, so we focused on the portion of the ECCN toolkit that is the quantitative guidance. So the baseline assessment used a majorly survey, and our primary respondents were students. The program works with students from 8 to 15 years, but for this case, we had to limit our sampling frame to students who are 12 to 15 years. Therefore, the toolkit focuses on those 3 components of SRGBV: corporal punishment, sexual violence, and bullying. But the technical working group, which is the arm of the Ministry of Education of the government of Liberia that works with us and other partners on institutionalization of education programs, guided that the components of health, disaster risk reduction, and environments, as well as gangs and substance abuse, would be relevant. So those were pieces that were covered in the surveys that we designed.
Great, thanks so much, Apollo. And I think another important aspect of your work from, we worked together on the piloting process, was the protocols that were established and recommended to you in order to make sure that when you were doing research with young people, what would happen if, as you were asking these sensitive questions, one of them were to become upset. So if you could just speak a little bit more to your process in that, I think it'd be helpful.
Yeah, absolutely. And so first of all, engaging with the technical working group, which is helping the activity with institutionalization, helped us to begin to understand what contextualizing this toolkit and the surveys and items would look like. We got initial feedback on items such as, if you're asking Alana, did anyone touch your private parts?
Yeah.
And the recommendation was, no, you shouldn't ask such a question. You should ask, did anyone touch you in a bad way? So from language to phrasing to appropriateness of the age group to appropriateness of interviewers based on the local context, we got a sense that we wouldn't be using the EDC IRB that is usually the standard procedure for us to use, but it would be better to get the University of Liberia IRB to engage with them and get more in-depth feedback on what a potential risk could be and what they would be recommending as safeguards to those risks. So that is how we got into engaging with the University of Liberia IRB. And indeed, there were a number of points that were raised.
So some of the points that were raised by the University IRB is that we needed to have trained social workers, people with experience in social work, so that they could provide counseling if there might be cases of signs of distress of those that were responding to our questionnaire based on if they have some previous traumatic experiences. In addition to that, we also were able to do a mapping of service providers, or one-stop centers as we call them, so that if we had some instances coming up, we could refer these learners, if the counseling have failed, we could refer these learners there and provide some psychosocial counseling, some legal assistance and support to survivor of SGBV. We were also, some safeguards that we also put in place is to make sure that during the interviews, if there were instances of mistreatment or abuse, we could also report these to the respective county police office through the one-stop centers. So those were also safeguards that were recommended and that were embedded into our stuff. Also, we, in the consent form, one of the recommendations coming out from the IRB was that if there were issue of ethical concerns from our end, we needed to include their contacts so that people could reference them and raise their concerns or report those concerns of ethical breach. In addition to that, one of the measures we took seriously was to make sure, looking at the nature of the question, the sensitivity of the question, and looking at our own cultural context, we had to we had to have a set of interviewers that will include both male and female. So the purpose was that we will have the male interviewers interviewing boy students, and we'll have the female interviewers interviewing girl students, so that to provide a friendly environment to build rapport. Because if you look at our Liberian context, there are certain questions. If a male asks a female, she will not feel too comfortable to respond to you. And what you may get out of that interview may be something out of embarrassment. So to avoid that, we kind of pair people so that they could easily pair with people who feel free to talk with them. In our culture, a boy cannot ask a girl if she's has some sexual experience and things like that. That's like out of the culture. So we had to ensure those were in place so that people who are doing the interview feel free to get the responses and feel free to interact with them.
And I think just to add to that, there were, I think, other safeguards that were already built into the toolkit that we appreciated very much. For example, the scenarios or case studies that introduce a discussion about bullying or sexual violence or corporal punishment. Most of the work that was done on our part was to just contextualize it a little more.
Yeah,
spell out the words a little differently or change the names in there. But those were very good ways of introducing these topics to the learners, to the students. And then the approach of asking the student if they know anyone in the school who has experienced such a thing or in their family before asking if themselves have experienced it gradually builds the rapport and trust and makes it easier to carry through that kind of conversation. So those were also safeguards that came up during the discussion with the IRB team, of which we had we did a written application, but also had face-to-face discussions and interactive clarifications of different questions. Those came up as important safeguards within the toolkit, and we really appreciate those also being into the ECCN toolkit.
Great, thank you both. That was extremely useful. So now I want to turn to our friends Mary Manel and Sarah at FHI 360 to share some of their experiences with 3 RERAs and 1 SLE assessment. Go ahead.
Sure. So I can speak a little bit to the IRB process that we went through for a study that we did on school-related gender-based violence in Nigeria, and this was using parts of the SLE Toolkit. So as a research organization, going through an IRB is pretty par for the course for us. So we are required to put any research products or anything that is similar to research, like an assessment, through an IRB. And we're lucky to have an IRB in-house. So we have a Protection of Human Subjects Committee based in North Carolina that we put all of our research products through. And we let the IRB make the determination about whether or not it's research. And so that's one reason to do it, just because we have to. But another probably more compelling reason is that we just consider it really important when we're working in these sensitive contexts to make sure that we're treating our participants with dignity, that we're making sure that they're safe and taking all of the necessary protections just to safeguard them. And a lot of the times we talk about IRB as this kind of hassle, but it really helps us think through what are all of the risks that could possibly come up and what is our plan for mitigating them. And so it's not really so much a question for us, like, are we going to do this? It's kind of more of a norm. So we typically, or we'll put all of our research products through an IRB. So that's kind of where we're coming from. We can talk a little bit more about, what came up throughout the IRB process, what were some of the pushbacks that we got, and then how we address those. Do you want me to, I can go ahead and speak to those a little bit more. So one thing that we found was important was to kind of keep our questions more at a general level. So we had a quantitative survey, for example. On the one end, that it asked students and teachers questions about school-related gender-based violence. So on the one end, we could have asked questions about how often this violence was occurring, were the perpetrators teachers or students, but we found that just because the environment around it was so sensitive, we needed to move in a more general direction. And so what we did for our quantitative survey was instead to ask yes or no questions. So has this happened to you at all? Yes or no? And that helped remove some of the pressure we found. And then when we were in focus group discussions or in interviews, what we did was to make sure that the participants didn't bring up names of perpetrators. So we didn't want them to identify anyone specifically. We also, especially in the focus group context, didn't ask anyone to talk about specific experiences that had happened to them, just because we thought that the risk around that would be too great. And I know Miriam can talk about some of the strategies that she's used working on RERAs and SLEs as well.
Sure. So the experiences that I'll be sharing today come from my experience working on 3 RERAs and the SLE in Senegal. So the RERAs were in northeast Nigeria, we're in southern Senegal, and also in the eastern DRC. And so, as Sarah had mentioned, one big thing was, of course, keeping those questions general. Another big thing, and our colleagues from the Liberia team at EDC did talk about this, was really establishing contextually appropriate protocols for what happens if we do hear these incidences of not only school-related gender-based violence, but gender-based violence at large. And the reason that we also had gender-based violence at large is for all of these RERAs, we also added a do no harm lens to the questions and tool development. So we added in a few other questions that look to really understand community dynamics. And that was also because our IRB was asking us to keep things a little bit more general. And so we were like, well, if we're not going to be asking these questions specifically to the youth that we're speaking to, we want to still understand if these factors are at play from other members. And so for that protocol and process, there are a couple of different approaches. And I know Sarah also thought this through for this other study in Nigeria. One of them is specifically, before you get there, identify your sources in the community that can help if you have somebody who has experienced this. Who can you refer them to? Whether that means, such as in the Eastern DRC, that it is a local women's association who might not have that psychosocial trauma training officially on paper, but has all of the know-how and contextualization of how do we deal with this. Or if it happens to be an actual organization, such as in the case of Northeast Nigeria, somebody within the camps or an international organization that has that professional training, Or in the case of Senegal, we actually had a protocol that was given to us from the Ministry of Education. And that came up especially, not for the RERA, but for the SLE, in which we were accompanied by a Ministry of Education official, which helped with getting buy-in from the schools to ask those questions and to contextualize our study. But also like, hey, they have specific, they call them the cellules, so different organizations within the ministry system that tell you, how do you respond to this officially? And so based on the context, we really tried to have a tailored response to if this came up, and if it ever did come up, whether it was in a one-on-one interview or in a focus group discussion, we would look for those cues and respond accordingly, not directly during the facilitation, but afterwards by providing those resources. Another big thing is, we talked about who we were talking to, lots of youth, both in school and out of school, was establishing protocols for parental consent. That was a big thing that our IRB wanted us to consider. On paper, this sounds great. You get to call the parents ahead of time, assuming that they have cell phones, or you find the parents, or you tell the schools who you want to talk to and then get consent all around. That doesn't always occur when you're in the field. So one big protocol that we had was, as you can hear, we wanted to talk to the parents first and get that consent first. Different methods, whether that was doing sampling the night before to know which parents we had to find, or whether that meant actually going down into the villages or the city or the community, wherever we were, depending on the locale, and finding the parents after the sampling was done. But we had to show our IRB that we had a system in place, and that was a big one. And I think towards the end of our conversation today, we can talk about some of the things that went right and some of the things that went wrong. So I'll save that example. And like I said, we did talk about a do no harm framework. What that means is we added a few questions that would have us talk to some other respondents that weren't necessarily youth. And the reason that we did that is if we're omitting some questions because of their sensitive nature to students, and in our case for Senegal, that's where we had the youngest respondent group, where we were speaking to students as young, or children really, they weren't all students, we also spoke to out of school youth, but as young as 9, we really needed to add in some additional people that we spoke to make sure that there was balance. So we also spoke to religious leaders, both majority and minority religious leaders, to get a better sense of the overall picture. We spoke to female leaders, and I'm talking about out-of-school stakeholders. We spoke to security sector officials and local government officials who might have a sense of why are we calling, what are the incidences in which we're involving a conflict resolver, whether that's the priest or the pastor, or whether that's a police officer or a security sector agent. So we could get a better sense of when are we experiencing these situations of violence in schools or around schools, and how can we get a better sense of what those are about. And so I think those were a few of the ways that we were able to address the IRB's concerns while still gathering the information that we wanted, although it would not necessarily be directly from a young person. And so that's really some of the ways that we wanted to share about how we quickly responded to that. I think Sarah is now going to share a tiny bit about what we learned from the process of adapting these concerns from the IRB.
Yeah, sure. So I can just talk a little bit about kind of what we learned from the process. I would say that because we expect to go through this process, we typically do budget for the time to do it. And so we try to have at least 4 to 6 weeks before we start data collection to allow for this to happen. I realize that sounds like, or may sound like a lot of time. And so one way we found to reduce this timeline is to communicate with our IRB contact person ahead of time, talk through the study, talk through the key issues that we think are going to come up, so that we can submit the most complete protocol as possible, because honestly, it's really the back and forth that takes up all of the time. So really trying to front load the IRB with all of the material that they're going to ask for. And another thing that we've noticed is that even when a project isn't deemed research, if it's more of an assessment, we found that it's still really helpful to go through to develop a full protocol. At the very least, protocols around informed consent, especially if minors are involved, how you're going to maintain confidentiality, and just considering the different physical, emotional, and psychological risks, and developing plans to mitigate them. So those are some of our overall lessons learned.
So I think next we're going to be talking to the teams that were involved in doing research with young people doing RERA or an SLE assessment, but did not necessarily have an IRB that they either had to work with or had the opportunity to work with, depending on how you look at it. So some aren't working with an institution with an IRB, and some countries simply don't have an IRB established. So we're going to hear a couple of those stories. First, we're going to hear from Frank and Tues from ACRUG in Uganda about how they went about doing their SLE assessment without an IRB. Frank and Tues, go ahead.
Okay, thanks, Gwen, for your submission, and thanks to the entire team, the panelists. So what we did, we had done a similar study about school-related gender-based violence. And due to the fact that this was a rapid assessment, we used some of the guidelines which we received from the previous study. So we used the same guidelines because it was almost the same, the same study, because both of them we are looking at escalated gender-based violence. And due to the fact that we also have the child protection protocol, we are a child protection organization. So we also followed the child protection protocol to make sure that we do our research in an ethical way. So that's what we did as advocates for child relief.
Okay, great. Thanks, Frank. And so I think because you're a child protection organization, I think the key message here is that you all as an organization do this every day. Your point of working is to make sure that children are not harmed. And so I think you were very aware, and we worked together on the SLE assessment. So I know this, very aware of what kinds of research you could do with children, but then also the protocols that you needed to have in place. And so I think, Tues, you wanted to talk a little more about how you trained your research team to make sure that they were asking questions sensitively, and also were able to recognize any children in distress. So do you want to go ahead and speak more to that, please?
Thank you, Gwen. First of all, when we are recruiting our research assistant, they had first go through an online training, research ethics training for NIH. That was their first key requirement. But after that, we also took them through the research ethics training, using research ethics training, and that's how we managed to make sure that our researchers are asking the question the way they're supposed to be asked. Second, on top of that, all the questions were interviewed, were asked in local languages. So we recruited researchers who knew the local language of the area. So that's how we managed to do that. And make sure that females interview girls and males, they were interviewing boys. But to some extent, some females, in the case of more numbers of boys, some females would interview boys, which is okay, but males only interviewed boys.
Okay, terrific. And so I think, the big question I have, having heard from all these experiences around, the processes that needed to go into place in order to make sure that research was ethical. Clearly, you all had this at the forefront of your minds. The big question that I have is whether then you were able to get the information that was needed in order to ultimately have, the sufficient material in order to design or adapt the program. I'm looking in particular to EDC Liberia because I know that a key question that was ongoing was whether or not the questions that were extremely sensitive in nature really needed to be asked. And I think for the purposes of the program that you're implementing, the answer was yes. So Apollo or Edwinio, if you could just elaborate a little bit more on, why it was so important to ask these very sensitive questions as it related to the programming that you were going to be doing.
Okay. We were trying to look at the safe learning environment, and one of the reasons why we were doing that survey is to improve the prevalence of school-related gender-based violence and other school-related risk. So if we needed to have some interventions, if we needed to improve program implementation, we needed to have this information to be able to address those. Now, for us, I think it was easier for us to be able to get the responses from our respondents because the first thing we had done, like Apollo mentioned earlier, we were able to map out schools that had the population of learners we needed to interview. That was point number one. Once we map out schools that had enough female students between the ages of 12 to 15, and we also have enough number of boys between the ages of 8 to 15, we kind of sampled those schools within those categories. And one of the things that we did to ensure that we were able to get the responses we wanted, we had to go ahead. We had a team ahead of us, ahead of the research team. There was a team of community mobilizers ahead of us, making sure the communities were aware, making sure that students who have been sampled, their parents were informed, and they were informed on the dates that teams were going to go there and do the interviews. So for us, that made it easier for us. And one of the reasons why it was easier for us to get the information, we kind of work with the schools so that we can have the interview in an environment that was considered as a private environment, not necessarily in the communities where the students lived, not necessarily to private settings, but in the school environment where at the time where students were not necessarily a lot of them on campus, and what we could ask for like in separate classrooms. So in the case where we had like 10 students to interview at a time, we made sure we had 10 classrooms, and each of our interviewers will have a student to himself in a locked classroom so that people are not moving on here and there and distracting them, so that students feel comfortable that the information they are providing are confidential information. So with all those safeguards, one of the things we also did from the paper questionnaire, we didn't put the learner's name in a database that we are interviewing student A or student B, even though for the consent and assent form, we had the names to ensure that based on the RRB request and based on RRB requirement, we had to do that so that students consented or assented that they were going to be interviewed and the parents consented. But those were destroyed after we had written up the findings, and they were not recorded in our database.
Yeah, I would add to that they are again on the line of safeguards and balancing between how to make the questions get to the aspects of safety that need to be assessed, at the same time be acceptable contextually to the learners and the other stakeholders that are reviewing the materials. There was a long back and forth, especially with the technical working group members on just mostly the phrasing of different questions, make them more polite. At the same time, we would push back on where the question intent is being significantly changed or lost entirely. So a lot of back and forth was going on those kinds of things. And then some of the concerns would be, for example, if you're asking about gang violence or substance abuse, there was a concern, for example, from the technical working group members on perhaps the students could interpret this as an expectation that maybe they're expected to be selling drugs, since now you're asking about it. And so when those kinds of concerns came up, we would agree on what would be a better way to phrase the question, so that the learner is asking, it understands that actually you're not trying to communicate an expectation to them that they should be perhaps doing this, but rather it's part of a survey that you're establishing different practices and risks and so on and so forth. So we didn't get into a situation where the questions we end up having are just safe but not useful to the needs of the assessment, but it was more the form and the phrasing of questions. That was improved or revised based on the interactions with the stakeholders here.
So basically contextualizing the questions to the environment that we work in.
Great, super useful. Thank you guys. So I'm going to pass it on now to Jim Rogan, who's going to talk a little bit more about his experience implementing RERAs, in particular when there were not IRBs available, and how then to ensure attention to ethics while at the same time trying to get the information that is needed for that particular piece of work. So Jim, go ahead.
Thank you, Gwen. Hi, everyone. I'll speak about one RERA in particular, the RERA for Cox's Bazar in Bangladesh, which we implemented in October 2018. And the situation that we had there was, and let me contextualize this RERA. This was a RERA that was commissioned by the mission through a Dexis support arrangement, and it was a sort of, let's call it a strategic level RERA that was not part of an existing or a recently awarded USAID activity. And so we had, true to form, trying to be rapid, we had 3 weeks planning. And even though we alerted ourselves to the need for IRB right away, we could not find an appropriate IRB institution in Dhaka, as the case was. And I should further explain that for this RERA that was going to look at the impact of the Rohingya population on Bangladeshi communities throughout Cox's Bazar, we were not going to be interviewing the Rohingya population itself, although of course they would be intermingling with the Bangladeshi populations and host communities a little bit, to be sure. That was the nature of the investigation. We also realized that given that theme, we wanted to create an advisory panel. So we had we had our own Gwen Heener on the advisory panel, Colette Chabot, James Jennings. So we had already some well-established and esteemed researchers as an advisory panel to the overall RERA exercise. And we had researchers and local academics who were part of our core RERA team. I say that because we pulled on all that capacity in order to try to identify an appropriate IRB, either within Bangladesh or through partner organizations. And I think if we had more time, perhaps it could have been feasible or possible to find an IRB. But then the 3-week time frame was very challenging. So we spoke with the mission, with the advisory panel, the advisory group within the team, and we came up with the idea that we want to try to do the maximum that we can in terms of upholding our ethical obligations. And we came up with the idea, which was to reach out to well-respected researchers in the education and emergencies field and approach them to create what we called an ad hoc ethical or ethics review panel. And so we tried to replicate as much as possible an IRB process, to try to put our protocols, our plans through some rigorous vetting as much as possible, and at least get feedback from these people in terms of how we could improve our ethical standards. We ultimately had Ash Hartwell and James Williams join us on that ad hoc review panel. They served in their individual capacity. They were not representing either UMass, Amherst, or GW. And so they were doing this through their individual capacities. And what I submitted to them was everything that would try to replicate a submission for IRB exemption. And through that process, we submitted all of our protocols, all of our plans, our conflict sensitivity approaches. So basically everything that we had put down, and luckily at least we had that pretty well designed already. And we submitted that to the ad hoc panel, and they came back with the questions that emerged, and the issues that they highlighted were, one, that the nature of the research generally may be considered exempt. However, because we were going to be dealing with minors, that triggered us to at least normally go through an expedited process. Also, they highlighted the fact that our researchers, both our core RERA team as well as any data collectors, should go through the city research on human subjects training, which I thought was also something that was very useful that we're keeping in mind now. So all to say that we fell short, I think, of doing an appropriate IRB process that would be expedited. We didn't have enough time. I think we did all we could to try to replicate that process, vet our approaches in terms of protecting our human subjects, especially minors. And I won't go into those steps because the other speakers have really touched on, I think, in detail, a lot of the approaches which we actually followed ourselves as well. I can answer questions if you want. but I think this situation of, the tension between trying to carry out a rapid exercise, 3 weeks of planning, 1 to 2 weeks or a week and a half as the case was in terms of reaching out to respondents, that was a difficult situation when you don't have an IRB facility on hand. So maybe I'll stop right there to open up for questions, but I'll leave it there for now.
Great, thanks, Jim. It's very useful. So before we go into a live Q&A, and I want to remind everyone that if you do have questions to any of our speakers, drop it into the Q&A box, and we'll probably have time to get to them. But I did want to turn to our panelists also, and come back to the idea that as much work as we do in setting up our ethical protocols to be as comprehensive as possible and to be as aware as possible about the things that might happen as a result of our research, the reality is in the field things happen and you can't always control them. And so I think we have a number of interesting anecdotes that we could hear to learn more about how can you be responsive on the ground when something comes up, and maybe how that informs a protocol that you put together in future. So I think Miriam, Manel, and Sarah might have some to share to start.
Sarah? Oh, you can. I think you have a very, very interesting story to tell about parental consent. So
yes. So in Senegal, we had done a lot of thought about how for our SLE, which was done in May of this year, so just a few months ago, how are we going to get parental consent and also uphold our standard of random sampling? And so we had on paper thought that we would get to the school in the morning, randomly select some students, find their parents, whether that meant calling or getting on a motorcycle, going into the village, finding that specific parent, asking permission, coming back and speaking to students. That was all fine and great on paper, but when we started doing it, the reality was you can arrive at a school and you can have your school director already choosing which students you're going to speak to, and then you have quite a few ethical concerns. How are these students chosen? Are they the top students? Are they the worst students? Are they students that this director knows won't say anything bad or will say things to try and get more funding? There were a lot of more questions and answers. So what we ended up doing is, even if students had already been selected at the school, we would redo the random selection. We would do the survey with all, so not to offend any parents that might have already showed up at the school. And so we had extra data than we might otherwise have had, and we had marked which ones we would actually use for analysis and which would just be more informational for the program. So it was one thing that happened that we really had to respond to and make sure that we were keeping in tune with. And sometimes if a student was randomly selected, we could find their parent, then that didn't happen. But what we did do, and where this also kind of ties into a different ethical concern, is when we went through the whole parental consent process, things took time. And May in southern Senegal, it's Ramadan. I was also fasting, and so I could feel with the students and the parents when it's approaching 4 o'clock and you're still doing interviews and they're still hanging out at school. There's this other human ethical concern of, it's hot, it's 106 degrees Fahrenheit. It's starting to get close to time to break fast, and we're keeping these people because we need to finish the study. What do you do? And so we took the liberty to offer rides back to the community, especially in the more rural areas where people were living really, really far away, to maintain those consent protocols, to maintain being able to speak to them in advance. And so when we called schools further down in the data collection process, we would let them know that, yes, we would come pick up the parents and drop them off. And got that clear to the IRB so that that they knew that would happen, but it wouldn't be any of the enumerators themselves doing the drop-offs and pickups to maintain that separation. And just really try to adapt as best as we could to ensure that we would get that done. The ethical piece that maintains the IRB, but was also not at the risk or expense of our students or parents for the SLE data collection piece. And so that's the example from Senegal that I wanted to share on. What does this actually look like? How are you managing your time and getting this all done?
Great, thanks so much. That's helpful. And I also think Frank and Tues, I think you've shared a story with us about when you approached the field and found an incident of a student who had been hurt the previous day. If you want to share that story.
Yeah, thanks, Gwen. So we experienced a scenario whereby our research team in their school, they happened to meet learners But among those learners they met, they had experienced an incident on corporal punishment. A learner had been beaten and he fainted. So when this learner fainted, they rushed him to the hospital. But when our research team, reached in the morning, they thought maybe it was due to that incident that the team, is in that particular school, but which was not the case. So we went on with with our interview, and due to in the middle of the interview, because as some of the questions, we had questions on corporal punishment. So the research participants disclosed that incident, and when they disclosed that incident, our child protection team, after we had finished the survey, followed up on that case, and he made sure that the learner got justice. So we followed that case up to the end. Yeah, but it was a surprise to us because, maybe we came in the right time when, this was happening. So, yeah, that's the scenario we made.
Thanks, Frank. That's helpful. All right, so I'm going to start turning to some of the questions that we've received in both the Q&A window and also as folks have RSVP'd to the webcast itself. One from the RSVP is, I'd like to know about the involvement of disabled people's organizations or peoples with disabilities in the data collection process. I think FHI has a couple of notes about this, and then also I'll pass it to Jim when they're done. Go ahead.
Sure. One big thing is, as we included the Do No Harm framework as part of our RERA, we also included a GESI framework as part of our RERA for the DRC. So GESI stands for Gender Equality and Social Inclusion Framework. And so what that meant is we specifically sought out speaking to representatives of disabled people's organizations, as well as students with disabilities, and speaking to other community members living with disabilities as part of our research. So there was a specific respondent group that we worked with our people in the field to find people that would fit that respondent group and speak to them. So in each of the 4 regions in the DRC, we did speak to people living with disabilities and had an entire analysis piece within our assessment focusing on that.
Great. Jim?
Sorry, I had to mute myself. Similarly, I think for Bangladesh, in simple terms, two steps. One was that we knew this was going to be an important issue. We had as one of our main research questions, which was, what is the status of certain important cross-cutting issues? One was the situation of people with disabilities and access and other issues. And we, similarly to what Miriam said, we reached out to local partners such as the Center for Disabilities in Cox's Bazar. So we tried to, as much as possible, reach out to those local organizations focusing on people with disabilities and disability issues.
Thanks, Jim. All right, another question that came in from the RSVPs. Should someone like INE or ECCN review the rapid assessment before the implementing organization uses it in a crisis context? I'll start answering this just a little bit to note again that ECCN with USAID very closely, and Ashley in particular, developed these tools themselves with a particular eye toward being as prescriptive and as clear as possible in terms of what it is that it means to be ethical in doing this type of research. But I do want to pass it on to Ashley, perhaps, to comment a little bit more about how USAID has been involved more precisely with each individual RERA in particular. And yeah, go ahead, Ashley.
Sure. Thanks, Gwen. Yeah. So do we need to review these assessments? Not necessarily, depending on how you engage. And there are 2 main ways in which in the USAID program cycle where we do a RERA. One is the situation that that Jim referenced for Bangladesh, which is at the strategic level. So it's not embedded in a specific activity. It's to inform our country development and cooperation strategy, or a lower level strategic document, or inform the design of a new activity. So in that case, USAID has a bit more involvement in the RERA, and we would provide feedback. You would have a USAID contact either in the mission or in USAID Washington, where I work, or so it could be me, for example, reviewing your protocols, providing feedback, just making sure that the studies answering the questions that USAID is interested in order to inform our strategic documents and let us know what we need to do on the ground. In the other instance that maybe some of our other partners on the call have worked in, you're doing a RERA embedded in a program. So an activity is awarded. It's been a long time since that program description was written or that proposal was written, or rather it's the first time this implementing partner is working in this situation, and this is an crisis or conflict environment, so the context is always changing. So we need to get up-to-date information. In that case, the implementing partner may implement the RERA a little bit more independently without so much USAID oversight. That being said, from the perspective of this webcast, maybe you need the overview or assessment of an ethical review board, so an IRB or an ad hoc ethical review board like Jem described for Bangladesh.
Great, thanks, Ashley. Another question in the Q&A box, it's a bit long, so I'm going to summarize it, but it's from Kayla Bover. She's interested in hearing more about the issues around power and ethics, even with consent and assent procedures, referral mechanisms, and social workers in place. When an NGO or donor or another otherwise powerful entity comes into the community, children might feel compelled to speak. I think this is extremely important. Just because we say you can say no, who's to say they're going to? I think Miriam, Manel, and Sarah might want to chime in on this one, and go ahead.
I think a big piece of this has to do with who your data collectors are and who your enumerator team is. And I think that in Senegal, we had a very, very good approach for going for precisely this. We made sure that each and every single one of our data collectors was somebody from the community. We made sure that they spoke the local languages. We made sure that, if I show up in the ground, on the field, on the ground or in the field, sorry, I don't look Senegalese. I don't look like I'm from the DRC. I don't look Nigerian. And we wanted to make sure that there wasn't immediately that huge appearance. We wanted to make sure that the person could speak the local language. We wanted to make sure that they were from the community and were not necessarily a familiar face, but associated with whether it was a partner organization or local association or somebody of the community with whom that those students, teachers, any stakeholder that we were speaking to could establish a rapport. And so that's one big thing that I would suggest is really think about your selection criteria of who's doing that data collection, thinking about local dialects, and also think about some tensions that might occur also if you're bringing somebody in from the community to find out information about the community. So of our teams, we made sure that it was balanced in that there was someone from that community or region really when doing the data collection, but there was also somebody who wasn't. We also thought a bit about gender balance so that at any point there was, this is also going to another question that we saw about some gender considerations and how do you weave that into the protocol and on the ground. And I think Sarah's going to chime in on that.
Yeah, sure. So, just kind of the basics of making sure that the enumerator teams were balanced by gender, but also at a more substantive level, thinking about how to train enumerators to recognize signs of distress and how they might differ by gender. And so thinking about like what that would look like for boys versus girls, so that enumerators know when they need to intervene in a situation. And also just designing questions appropriately for boys versus girls. So that's something, you definitely want to keep in mind as well. Easy things like making sure the enumerator teams are gender balanced, making sure you're, doing focus groups with only girls, focus groups with only boys, and then also thinking about it, more substantively.
And the reason that piece is so important was because in situations where you are taking community members in, you don't necessarily know their level of familiarity with data collection. So really hammering that home and in training was really important. And for the DRC context, for our RERA, we actually used staff members as some of our data collectors. We were very much in the inception startup phase, so they weren't, there wasn't a conflict of interest quite yet. They were still impartial. So that was one way that we really tried to get over some of those issues of power and ethics. Was really thinking through who was asking the questions and when was it appropriate to show somebody from the home office, in the field and when wasn't.
Great, I think that's useful. We're nearing the end, and I just want to say thank you to everyone who's shared these experiences. It's not always easy to share when things are challenging, when things don't go perfectly, but I think it's important that we're all honest with ourselves about how difficult it is to do field research and maintain attention to research ethics and do it rapidly and get the information you need to inform a program. I think the main takeaway that we should have from this is it's extremely important, though, as hard as it is. However, it's not impossible. And there's a number of resources that can help you that will help you to carry out the research ethically. And I want to point again to ECCN's products, the RERA and the SLE Toolkit, that have a lot of guidance for you. And also feel free to reach out to Jim and myself, Jim for RERA, me for the SLE Toolkit, if you have specific questions about implementing those tools. We are going to have an event webpage set up. It's going to be the same link you used to get here. We'll have a recording of this available there and also some resources that you can click on. And finally, our email addresses to be in touch. So thank you everyone for joining. It's been lovely to have you. Have a great Tuesday and talk to you soon, hopefully. Bye.